Would you believe that I have a lab tech that worked in an all-women's hospital in the United States who went to school for 4 years for parasitology, so she does have an understanding of parasites and what she is looking for. The results that she was finding in these women coming in with UTIs, urinary tract infections, was showing parasitic larvae. She was putting them in her reports, and the doctor of the lab was removing them from the reports. So these women with urinary tract infections was never getting properly diagnosed in the United States. The CDC and HHS does not allow that, because if you actually found out what ailed you and got cured, got the proper treatment, you wouldn't need your doctor. You wouldn't need your big pharma pills anymore. Parasites are very common, and most people have them. Some of the symptoms of parasites that most people don't know is gastrointestinal issues. So we're going to say things like IBS or IBD, Crohn's disease, colitis, appendicitis, cholecystitis, or gallstone. Your heart rate fluctuations up or down, or both. Your teeth breaking, your bones breaking easily. Blood pressure. There are so many symptoms of parasites. And yet we've named, not we, but the elites, John D. Rockefeller, named all of these symptoms of parasitic infections as a disease. See, remember when we had a hookworm problem in the United States and he eradicated them? No, he didn't eradicate them. What he did was rename them. But let's not talk about the vaccines that we give to our children. It's on the CDC's website. If you go to GenBank and look up any vaccine, they all have eukaryotes in them. They're purposely infecting us, from what I've read, to make us sick. It's all about population control and transfer of wealth. Population control. Well, if we make you sick, you can't work. You're dependent on the government. You've given up all of your rights to make any money, basically. You go to the doctor. You have a little bit of money in the bank. That little bit of money ends up going to your doctors for testing.